Thank you.
Yeah, thanks for your question. This has been something we've been working on for the last few months. And I guess just for context, if we go back, these medicines, first were approved in late December of 2021 and started shipping out here across Wisconsin in early January. So they are still relatively new. And very early on, they were in very short supply. So we really encourage providers to be pretty diligent in using the very limited supply we've had. As time has gone on, the supply has increased quite a bit, which is why you saw the press release today. We haven't seen too much of an uptick in utilization. It is slowly increasing, but it's taken some time. And from outreach to local public health systems, physicians, and there's likely a variety of factors that are going on here. On one side, right, there's because these drugs still are relatively new, there's not necessarily the patient awareness that we would expect for other drugs. So that's one factor. Patients just may not know these are available and what they can do. There can be in some cases, barriers to access, as you point out, although we've made a really concerted effort over the last couple of months to make these as widely as available in pharmacies across the state. We have nearly 350 retail pharmacies that are carrying either Paxlovid or Lagevrio or Molnupiravir, the other oral antiviral. On the provider side, there's kind of a combination of awareness. It does take a while for providers to gain familiarity with new drugs, develop processes and protocols for prescribing them. And there's also, I think, been a perception that these drugs continue to be very scarce. But fortunately, we've kind of moved on from that point. We now have enough to really treat people here in the state that are likely to benefit from either of these drugs.
Thank you. Now to David Wahlberg from the Wisconsin State Journal. David?
Hello, thank you. I guess other than that main message and what you have in the press release, I mean, since this has been talked about in previous weeks, what's the main word you're trying to get out about this today?
Really, the main message we want to get across to people in the community is that A, these drugs are available. B, for Paxlovid specifically, they're very effective in preventing severe disease. In the testing of these drugs, Paxlovid's been shown to reduce hospitalization and death by 88%. So it is highly effective. And what we really want people to know is that these are available throughout the state. If they are at risk for developing more severe disease, we really encourage them to get tested very soon because these drugs, either one of these, have to be started within 5 days of symptom onset. So it's very important for people to get tested when they develop symptoms early on, contact their provider to see if they're appropriate for treatment, and then get connected to care. So it really is a timing issue. Paxlovid really has the ability to reduce a lot of the severe disease that we've seen in multiple waves over the past 2 years. And we want to make sure this drug is being used in a way that helps people and helps our health system overall, because there is a lot of potential benefit there.
Thank you. Now to Katie Thorson from WXPR Radio in Rhinelander. Katie?
Thank you. I'm just at what level or severity of symptoms should people be reaching out to their provider to ask about these drugs?
So it's really not a matter of severity of symptoms. It's really a matter of getting tested as soon as you begin to develop symptoms. And I think, as most people are probably aware by now, early on after a COVID infection, the symptoms can be very mild at first. That by itself is enough reason to go get tested and see if you do have COVID-19. Because, as I was just stating, these drugs have to be started within 5 days of symptom onset. Don't encourage people to wait and see if they get worse. If they are at risk for developing more severe disease, it's important to get diagnosed as quickly as possible.
Thank you. Now to Alex Moe from wisbusiness.com. Alex?
Hi, thanks for taking my question. Do the numbers of Paxlovid and Lagevrio medications that have been distributed to healthcare facilities represent the state's entire stock of these treatments? And if not, how many courses of each does the state have on reserve?
So the way the ordering works is that the federal government makes a certain amount available every week to distribute to healthcare facilities across the state. The state doesn't take the drugs physically into possession and then distribute them out. We essentially are given an allotment from the federal government. Healthcare facilities, whether they're pharmacies or hospitals, can put in a request for those medications, and then they get shipped directly by the federal government from the drug distributor. So that amount, can vary a bit week to week. But if we go back and we look at the data to date, we've distributed about 12,700 patient courses of Paxlovid and about 2,800 patient courses of Lagevrio or molnupiravir have been distributed to healthcare facilities across the state. So as I was saying, with nearly 350 retail pharmacies with one or both of these drugs in supply, they are widely available and on the shelves.
Thank you. Now to Davy Shastri from the Milwaukee Journal Sentinel. Davy?
Hi, thank you for doing this call. Could you speak a little bit about test to treat options in Wisconsin and how things are looking as access or availability of these treatments gets more widely, spread out? But I think test to treat sounds like it's a pretty critical second piece to this.
Right, because it is important to go, quickly from symptoms to getting tested to being diagnosed to getting a prescription, because that timing is very important. The federal government did start that test to treat program, which I'm sure you've heard about. And the idea with that is, of course, is a one-stop shop where if you get symptoms, you can go in, you can get tested, you can get evaluated by a provider, and you can walk out with the prescription in hand. So those locations have been identified by the federal government. They're really limited to pharmacies that have an on-site clinic where a medical provider can provide the prescription. And so right now, as of today, we have 16 test to treat sites throughout the state. Those are primarily Walgreens and CVS locations. Those are available. You can see those marked on our therapeutics map that's hosted on the DHS website. The hope is that over the coming weeks, more of those places will be identified by the federal government to participate in this program.
Thank you. And we'll now go back to the top of the list for any follow-up questions and begin again with Sean Kirkby from Wisconsin Health News. Sean, a follow-up?
Thanks, I'm good.
Okay, David Wahlberg, Wisconsin State Journal.
I can just shift gears slightly. I noticed that with the wastewater surveillance data about COVID, that the Madison area now shows a major increase recently. Can you just sort of comment about the significance of that and just the latest with the wastewater data?
Sure, I can kind of speak to that briefly. And overall, what we've seen are kind of consistent, steady increases in many of the wastewater treatment plants throughout the state, consistent with an increasing community transmission. When you see those major increases, those are relative to recent measurements in the wastewater. That doesn't mean that the levels of virus in wastewater are at a high level. It just means that they have increased relative to recent measurements. Overall, when you look at the state as a whole, we're doing surveillance. The levels of virus remain relatively low, yet we're seeing consistent kind of persistent slow upticks. And I think what we're seeing now is kind of that being reflected in diagnosed cases reported to the state as well.
Thank you. And now to Katie Thorson from WXPR Radio. Katie, do you have a follow-up question?
Yes. I know, and correct me if I'm wrong, but I believe these drugs were tested during previous variants of COVID. So I was just wondering if you have any data or information about how effective it's been with Omicron or the latest variants that we're seeing now.
Right, yeah, so there have been a variety of drugs that have come out. They can be kind of difficult to keep track of. The monoclonal antibodies are the ones I think people are most familiar with. And those are the ones that have been proven to be less effective when new variants come along. Because those antibodies are fairly specific to the specific type of virus. With Paxlovid and Lagevrio, both of those are much more durable. They both appear to work very well across many different types of variants. That's one of the main advantages of Paxlovid, is we don't have the same concerns with the emergence of new variants about the effectiveness of that drug in particular. So it is, like I said before, it's a very effective tool. It's been shown to be very effective in preventing severe disease, and there are many fewer concerns with the development of resistance. Obviously, that's something that I think we'll continue to keep an eye on. That's something that the FDA is closely tracking to see if there are any signs of potential resistance to that drug. But so far, it appears to be very effective regardless of the variant that's circulating in the community.
Thank you. Now to Alex Moe again from wisbusiness.com. Alex, a follow-up?
Thanks. On the oral antivirals, do these medications go bad or expire? And if so, how long will the current supply of the sites in Wisconsin last before being non-usable?
Yeah, I mean, every drug that's distributed does have an expiration date. We can get back to you with specifics in terms of expiration. It really depends on the lot number, and there have been many lots that have been shipped over the last few months. So we can follow up with you offline after this call with more specific information on that supply. I will say, to kind of add on to that, the federal government has purchased up to 20 million courses of Paxlovid. So there's a lot of the drug in the pipeline, either being manufactured or being shipped out. So even if some of these doses that were initially shipped expire at some point, there should be plenty of supply in the pipeline to backfill any of those.
And our last question this afternoon belongs to Davy Shastri again from the Milwaukee Journal Sentinel. Davy?
Could you just speak kind of generally to the trends that we've been seeing in terms of rising cases and hospitalizations, and kind of the overall goal to decouple those two metrics? It seems like having these treatments more widely available is a big key to doing that. Have you seen that impact? Is it too early to say? Could you just speak generally to any of that?
Yeah, I think you're right on in terms of the goal, and I would back up and say, vaccination by and far is the most effective way to prevent severe illness. We've seen that during the Omicron surge that people that had 3 doses of one of the mRNA vaccines had a 94% reduction in severe disease. That means being put on a ventilator or dying from COVID-19. So first and foremost, we encourage anybody out there who's not been boosted to get boosted, because it does provide the best protection available. For those who are unvaccinated, or for those in whom the vaccine may not be as effective, those are people with certain medical conditions that may suppress the immune system, or people who are older. These drugs, again, provide an additional layer of protection. So as you said, our goal is really to keep people as healthy as possible, even if they end up getting infected. To your specific question about are we seeing the impact of these, it's very difficult to tease that out in the current environment. We have a lot of people that have been vaccinated, those that have not, many of those people have been infected. But what our ultimate goal is to get as many people as vaccinated as possible, have these drugs as an option for those in case people are at risk for severe disease, to really provide the best protection possible, because we really want to keep people out of the hospital and as you said, kind of decouple the case numbers from the impact on people's health and hospitalizations.
Thank you. And with that, that concludes today's media call. Thank you to Dr. Myman and all of you today for participating. If you need more information or have additional questions, please contact DHS Media at dhs.wisconsin.gov. Thank you and have a good afternoon.
Thanks, take care.